About our COVID update. This is being brought to you by the Snowdome Foundation. Snowdome's mission is to keep patients living longer by accelerating new therapies to patients with blood cancers. And so Snowdome's interest is to keep you informed about what's happening in the COVID space, because all of you out there are either carers or you have some form of blood condition or blood cancer. And it is a very anxious time for all of you at the moment because things, to be honest, are changing fast. 6 weeks ago, at the end of April, I said that we need to beware. Although the lockdown is loosening up, it may come into another phase. And in fact, that's what has happened. And in fact, that's really what was predicted to happen in so many ways, because once you've got a society where we're living in big cities, the capacity to keep these sorts of things under control is difficult. And you've heard the term suppression versus eradication. And suppression means living with COVID-19 for the rest of our lives. Should we be scared of that? Well, no. Flu we live with. Glandular fever is in the population. There's a number of viruses that we live with. What we have to move towards in the next few years is how we live with COVID. And ultimately, the answer is going to be around vaccination, and hopefully we'll be talking about that early next year. And so I'll come back to that at the end. But let's talk about the numbers. There is a lot of anxiety about the numbers, and in many ways 500 patients a day was, again, what was predicted in a population of Victoria, Greater Melbourne, of around 4.5 to 5 million people. And so that gives an incidence of about 1 in 10,000. And when you look at the UK, that is, when they were at their peak, they were about 1 in 14,000. And so we are really in a very similar situation, but you look at where we are. What has happened through the restrictions that happened in April is that we've been able to kick the can down the road. And our first phase is only coming now. But what we've been able to do is prepare, educate the community, tell them what it's like, what social distancing means, what it means to keep at home, to prepare for social isolation, the implications of that, as well as prepare our health system. And our health system is dramatically better and dramatically prepared. And compared to what the UK were facing in April, we are doing so much better. Ultimately, it's about saving lives. What we're seeing is that the numbers have got to about 300 to 500 a day, and hopefully soon, in the next couple of weeks, it'll start to drop below 300 to 200, but it will take a few weeks. As opposed to what could have happened if we weren't in lockdown of 500 to 1,000 to 2,000 a day. We're not going to see that. We're going to see it slowly come down. The elastic band will loosen. We'll be able to unsocially isolate and start to get back to where we were. And then there will be outbreaks, and suburbs, etc., will be shut down. And this is going to happen really for the next 6 to 9 months. So we have to get used to that elasticity. But what's important is that people are socially distancing. People are not getting the infection as badly. There's not as many admissions into hospital. There's not as many people getting sicker, not as many people going to ICU, and not as many people dying. And so what is translating is that although the numbers are up, they're holding, the medical system is coping with it. It is a tragedy about the patients who are in nursing homes, etc., who are dying. And that's ultimately because the biggest risk factors are, and I've mentioned this before, age greater than 80. And then after that, it's renal disease, hypertension or high blood pressure, and obesity. And they outweigh all of the other factors. So those of you with blood cancers where you're not getting active treatment, we're now clearly demonstrating that they're not huge risks. They are risks, but they're not huge risks. And so you need to be aware, you need to be diligent, but you don't need to be too scared. But it is important that we continue with the social distancing. Masks are part of that process. Masks are very valuable in reducing the aerosol spread between individuals. If we could socially distance perfectly, we probably could do without masks, but we've got public transport. We've got situations where we have to go shopping, where you can't socially distance or control. That's where masks are important. So please recognise that the need to wear masks, they're with us, they're part of the whole thing, but social distancing is really important. We know aerosol spread is the major way in which this is spread, and so beware. So what do we expect in the future? What are the big questions? Well, first of all, is that it is going to be going like this for the rest of the year. What's going to happen is that the numbers will go down. Restrictions will drop again. We'll be able to move out into the community, but there'll be breakouts, and it's likely that suburb by suburb there will be lockdowns. I think smaller communities outside the cities will be relatively safe. The rest of Victoria will probably be able to control it. I think the big questions that we're going to face that really are challenging is, what about travel into other states like Queensland, WA? I don't know the answer to that, except to say that it's a dual-edged sword. Those states are keeping themselves safe, but equally, we're in Victoria, we're managing this suppressive state rather than going for an eradication. And I think management of suppression is what the rest of the world are going to need to do. Travel is still a long, long way away. Vaccination is really looking promising, and I think we're hearing from all aspects of medical research that vaccination is going to become more available in the next, is going to become available in a variety of different manifestations in sort of December, January, first quarter of next year. So I'm very hopeful about vaccination, and I think we're going to see some surprises. So I think that the take-home messages from this week are: the numbers are not unexpected. They are distressing to people. They really bring home how virulent this virus is. But the number of infections is not putting too much of a strain on our medical system. The medical people are working extremely hard. It's very hard work to be in ICU. It's very distressing for people who are in hospital, who can't see their relatives. This is a pandemic that we need to control, and the only way that we're managing it is by good social isolation. And I think in the next week we're going to start to see those numbers very much stabilise and start to go down. The patients, no bad news from the perspective of blood cancer patients. You really need to be aware but not scared. So cross our fingers for those working hard with the vaccine, because that's the future. I think, though, don't plan any holidays interstate, because they're not going to be opening up those borders very soon. Plan your Victorian holiday. Bear with the social isolation. It's going to be a few more weeks, but we're going to get there again, and then we're just going to have to adjust and manipulate. So again, from Snowdome, we're trying to save patients with blood cancers' lives. A positive update. Hang in there. Be positive and keep well. Thanks very much.